Okay, good morning, everyone. It looks like this is as quiet as it's going to be, so we're going to take advantage and get started. So, welcome, everyone. Thank you for gathering this morning as we kick off National Health Center Week here in Orange County. My name is Isabel Becerra, President and CEO of the Coalition of Orange County Community Health Centers, and I will be your MC for today. Thank you to thank you for everyone who's here today, our partner stakeholders, as well as the leadership and staff of the several of the 27 community health centers that we represent today and that make up the Coalition of Orange County Community Health Centers. I see several of our members here today, and forgive me if I don't acknowledge you, and I see a couple of our board members, so welcome to all. Today you'll be hearing brief remarks from our gathered speakers. Each speaker will introduce themselves at the top of the remarks, providing you their name and title. Once the press conference concludes, we'll then be able to open the floor for questions, and speakers will be available for any interviews or additional questions you may have. Everyone is welcome to join us on a brief tour of our facility today after the press conference, and with that, I'll kick it off officially. So again, good morning. I've introduced myself already. And just a brief background about the coalition. In brief, we are a membership organization that represents the interests of the health centers that serve our community's most vulnerable patients. These are individuals that are uninsured or underinsured and face disproportionate risks due to structural racism and discrimination, and who our health system often overlooks. We represent, again, 27 community health centers. They, in turn, operate over 80 locations throughout the county, serve over 340,000 patients, and provide over 1 million visits per year. We're excited to gather an amazing group of speakers who have honored us with their presence and will formally kick off Orange County's celebration of National Health Center Week. And as a note, this is not only happening in Orange County, this is happening across the country and up and down our state. So we're happy to be a part of the celebration under the banner of closing the gaps on community health disparities. As you hear from each speaker today, community health centers improve the health and well-being of underserved communities, reach beyond the walls of conventional healthcare delivery to prevent illness and address the social drivers that cause poor health. They provide invaluable services to all of our residents, and they're in many ways OC's hidden gems, helping promote equity and helping communities thrive. So we are gathered here today at an amazing location, one of our community health center members, Children's Hospital of Orange County CHOC Clinic here in Garden Grove. This clinic is unique for its partnership with the Boys and Girls Club, as you see next door, the first in the nation to partner with the Boys and Girls Club. And because of this facility, the community has welcomed them and has enjoyed healthier health outcomes because of the great work done here at the clinic. To tell us about the clinic and offer us a formal welcome to this beautiful space, I'd like to call up to the microphone Anita Sankran-Piskan, Vice President of CHOC Primary Care Network and Board Chair for the Coalition, OC. Anita, thank you for having us, and the microphone is all yours.
Thank you, Isabel. Good morning, everybody. Thank you so much for joining us for the kickoff of National Health Center Week. It's truly an exciting time. So as Isabel said, my name is Anita Sankran-Piskan, the Vice President of Primary Care at CHOC, and I'm also the Board Chair at the Coalition. I have the privilege of overseeing 5 of CHOC's primary care community health centers, and I have the honor of serving as the incoming Board Chair for the Coalition. National Health Center Week is in a really exciting time, both locally and nationally. Gives us an opportunity to really celebrate all of the work of the community health centers and point a light on what it is that all of us do. Licensed community health centers, free clinics, and federally qualified health centers all fill a gap in the care delivery system. They are there to serve the underinsured and uninsured populations in each community across the country. It's a really incredible network of care providers, and we're happy to be able to celebrate them. As Isabel mentioned, one of the unique things about community health centers is that we are embedded in communities so that we are close to where patients are at, and we can serve patients where they need to be. This partnership with the Boys and Girls Club for CHOC has been incredible because it really allows Pediatric Health Center to be close to where kids are after school and serve in partnership with an organization that families see as a trusted resource. I'm honored to serve on the board of the coalition. The coalition itself is an entity that really has supported all of the community health centers in Orange County. It should be noted, right, their advocacy for really pulling all of the health centers together has been instrumental in really deepening the impact of every community health center in the county. So with that, thank you again for joining us and look forward to celebrating with you all this week. I'll turn it back to you, Isabel.
Thank you, Anita, for that. As Anita mentioned, community health centers come in all shapes and sizes. They provide an array of comprehensive health services. As a matter of background, in the 1960s, civil rights activists created the community health center model to remove traditional barriers to care, including race, insurance, transportation, language, and literacy. With roots in both the civil rights movement and the war on poverty, the earliest health center's mission was to use the healthcare system to change the lives and health of low-income communities. Today, community health centers across the nation, and specifically here in Orange County, play a crucial role in addressing health disparities, providing essential coordination, services, and management to community residents. By providing accessible care and empowering our communities to thrive. CHOC Garden Grove is just one of many of the health centers throughout the county, and they're an excellent example of the kind of high quality and accessible health care being provided in the neighborhoods throughout the county. And National Health Center Week is a time for us to be able to tell the stories and dispel the myths about what community health centers are and do for our communities. We'll be highlighting several of those members throughout the week, as we've mentioned before. And again, several of our health centers are here to display their support and effort. Later this afternoon, we'll be touring Families Together of Orange County in Tustin. And Alex is here. Thank you for joining us. So one of the vital partners in the work of community health centers is a wonderful organization, partner, and health insurance provider for low-income residents of Orange County. CalOptima Health serves over 940,000 patients every year, and they are the single largest county organized health insurer in California. With the motto, Better Together, they continue to partner with the coalition and its members to enhance community health in OC. I'd like to call up YK to the podium, CalOptima's Chief Operating Officer, to tell us about the great work at CalOptima and our partnership. YK?
Thank you so much, Isabel. It is really an honor for us to join all of you today in celebrating National Health Center Week. We are thrilled to be partnering with all of the community health clinics in Orange County the way that we have been for the past 30 years. As Isabel said, I'm Yoon-Kyung Kim, Chief Operating Officer for CalOptima Health, the health insurance company for nearly 1 million Orange County residents who receive their health care through the Medi-Cal program. Together with the community clinics, we really are the safety net of our community, and we proudly serve in that role. That role is more important now than ever, with Medi-Cal renewal occurring for the first time in 3 years. Our nearly 1 million members will at some point this year all go through a process of renewing their Medi-Cal coverage. The coalition and our community clinic partners here are vital to ensuring that members and individuals who need Medi-Cal keep their Medi-Cal, and importantly, for those who no longer need Medi-Cal, assisting them in still finding sources of coverage to ensure that their families receive access to care and that our communities remain healthy. I also want to highlight the work that the community clinics have done for generations related to health equity. Health equity, social drivers of healthcare, and the concept of one-stop shopping for health, wellness, and social resources, those were born in the community clinics, and we thank you all for that. CalOptima and the Medi-Cal program is now just able to support more of those efforts, and we do that with the learnings from all of you and with the partnership that all of you bring to the table. With your assistance, we are able to do more than ever before for our members in the space of social services such as housing assistance, nutrition. We are working with many community clinics on initiatives related to the CalAIM program, including services for our unhoused communities, including even building out supportive housing for our members and our communities. So thank you for that. I'd like to just end by noting that our community clinics have been there for our communities in the past, and we need them to continue to thrive into the future. As part of that, CalOptima Health and the Coalition are in the second year of a 5-year, $50 million project to continue to support our clinics, support their innovation, support their quality work, and again, ensure that they continue to be here for all of us into the future. Thank you so much for what you have done, what you continue to do, and we look forward to a long and strong partnership with you into the future. Thank you, and congratulations on this special week.
Thank you so much, YK, and thank you to CalOptima for their support and partnership always, but specifically during this critical time. Up next, I'd like to call up Dr. Sheikh, Deputy Health Officer of the Orange County Healthcare Agency. Welcome, Dr. Sheikh. The mic is yours.
Thank you. Thank you, Isabel. Thank you all, and good morning. I am Dr. Alma Sheikh, Deputy Health Officer for the Healthcare Agency, as well as a trauma and critical care surgeon. I'm also, for the time being, the Deputy Health Officer that is currently on one leg on a knee scooter, thanks to a pair of heels that I lost a battle with. It's a tremendous honor to be here to celebrate our community health centers. As we've heard, we have so many health centers across the country, 1,400 health centers across the country that really provide for that critical gap and really, truly are an important part of our healthcare system network. And it's through our community health centers that we're able to provide the care to those that are either underserved or don't have quick access to healthcare, whether in the hospitals or otherwise. And they become such an important network that we need to continue to support them with all of our efforts. So it's a great opportunity to see everyone here and be present to support not just CHOC, but the many healthcare centers that Orange County Healthcare Agency, as well as CalOptima, and all the organizations here that are partnering with, such as, the Access Healthcare Centers, Asian American Senior Service Centers, all of the agencies, Obria, Rainbow Orange County, many who are represented here, and many who we will be touring later today. Community healthcare centers, they are a beacon. They're really a beacon and provide service at times sometimes when really there's no other opportunities available. They can provide hope in moments of pain and in moments of loss. They can offer support. They can offer love, not just health care as we know it traditionally, but dental care, mental health care, substance use care, behavioral health care. And in moments of triumph, they're often the ones that are there standing with our community to be there for them, to allow them to continue to move forward. And we saw this most poignantly as our nation went through our global pandemic, when the healthcare agency was able to partner with our healthcare centers in order to provide that necessary care for the communities at a time when we really were in a critical moment. I really like to thank everyone for coming out here, the coalition. I'd like to thank CalOptima, everyone from the healthcare agency, all of our community healthcare centers for coming together to coordinate the celebrating showcase that comes during this week. The theme of this week is a road trip across America, and in that it will be a road trip across Orange County, as I know the coalition and various other healthcare centers in collaboration with CalOptima and the healthcare agency will be making road trips and stops at various health centers across our county. Thank you again.
Thank you, Dr. Sheikh. We truly value your partnership. Next up, I would like to call to the mic Dr. Rosemary Reyes, CEO of Central City Community Health Center, another one of our members who operate in the northern part of the county. Dr. Reyes?
Thank you so much. Good morning and happy National Health Center Week. My name is Dr. Mary Reyes, and I'm the CEO and family medicine physician Central City Community Health Center. It is truly my pleasure and honor to be here today and celebrating with you the milestones of community health centers across the nation. In December 1965, the very first community health center was established as a product of its visionaries, pioneers who were at the forefront in fighting the war against poverty. Federally qualified community health centers began embracing the mission and vision of servicing the underserved and becoming a safety net for its members. To date, we serve as the healthcare homes for over 30 million patients in over 14,000 communities. So what are exactly community health centers? The 4 qualifications include 1, we are located in medically underserved communities. 2, we provide all patients, regardless of income and insurance status, a unique sliding fee scale. 3, we are consumer governed, meaning that we have at least half of our board members who are patients themselves. And last but not least, 4th, patients are not turned away regardless of their ability to pay. We have become comprehensive care entities by providing services to the homeless, veterans, migrant seasonal farm workers, and the undocumented. We improve access to primary care and integrated specialty services such as preventative, behavioral health, substance use treatment, oral care, vision, and pharmacy services. In addition, healthcares offer a plethora of ancillary services to support patients' needs around food insecurity, housing, translation, transportation, and other social healthcare needs. So please put your hands together to celebrate National Health Center Week, recognizing our community health centers for delivering high-quality, affordable care to patients and reducing costs for America's healthcare system. We still have a road ahead and a lot of work to do. So thank you to the Orange County Coalition, our payers, our politicians, collaborators, for your ongoing support and commitment to our federally qualified health centers in our communities. Thank you so much.
Thank you so much, Dr. Reyes. We are closing our conference today with the distinct privilege of being joined by one of our champions in the Orange County Board of Supervisors. Supervisor Sarmiento is a champion for accessing affordable health care throughout the county. He's been a strong supporter of community health centers. We're especially honored to have him speak this morning and present a proclamation kicking off National Health Center Week here in Orange County. Join me in welcoming the Honorable Vicente Sarmiento of Orange County Board of Supervisors.
Buenos dias, and gracias, Isabel. You know, this is how bright Isabel is. She put the podium here in the sun, so our remarks will be brief and concise, and made sure that we had some quiet time as we're speaking. So well done, President Becerra. So I am Vicente Sarmiento. I am a member of the Board of Supervisors representing District 2 here in Orange County. This is my first few months. Actually, now we're going on our 7th or 8th, so I'm new to the board, but I've been a big fan of community health centers, so I want to just say felicidades on National Health Center Week. As a policymaker, this isn't just important to me, it's important to me personally because I was, my family and I were patients of a community health center in our community, and I represent a district that probably has one of the highest concentrations of people who access and use community health centers and a concentration of the health centers themselves. So, Isabel and I are proud to serve. She's my seatmate on the CalOptima Board of Directors, and so I've learned a lot just by asking her questions when we're in meetings because she knows so much of the history and the needs here in the county. But it's especially important for us to recognize that this is happening nationally. So what we're doing here today is happening across the country because over 30 million people and 14,000 communities access community health centers for their preventive healthcare needs. So it's an important time to us recognize, for all of us to recognize that the questions that are being asked of our community health centers aren't just medical, aren't just health-based, as was spoken. The questions are being asked of our clinicians and physicians about housing, about food insecurity, about things that create this entire, the inequities and the disparities that I think the community health centers have been at the forefront to try to address. So for me, it's especially important to recognize this week, but really we should be recognizing the good work all year round, because I was former mayor of Santana during the pandemic, and I saw personally and I witnessed personally, along with Isabel, we were on weekly calls, sometimes just trying to figure out what do we do. But I personally witnessed people's family members being affected. We had over 1,000 lives lost in Santa Ana, so we were a very impacted city. But the one blessing were the community health centers. They stepped up and they made sure that there was a safe space, but more importantly, a trusted space for people to go. And that's what I saw as mayor. What we realized is we couldn't just concentrate services in one place and have people come to us. We had to embed ourselves into the community. And that's what the network, I think, of the community health centers provides, is we realize that, if you look at our peer counties throughout the state, they centralize their services in county hospitals. And that's how they dispense their network of help. Our network is embedded in the community. And it's all over where the needs are the highest. And so, as you heard, the people and the demographic that's being served by the community health centers, to me, is the most vulnerable. And you're talking about folks who can't afford traditional health care. You're talking about people who are fearful of just disclosing very personal and confidential information. Those that are immigrants, both documented and undocumented, people with language barriers, people with mobility barriers. So that's what community health centers do. So I just also don't want to ignore the fact that these are small businesses. These are businesses that are operated by folks not sometimes franchised, but sometimes independent folks who want to open up shop. And I think what's important is that we realize that they have this commitment to making sure that needs are met. So for me, just knowing that we have a patient governed way of dispensing care is really important, because we can't ever lose sight of the fact that patients have a right to engage in the way healthcare is dispensed to them and their families. So with that, I am very proud to be here with you. I am very happy to proclaim this week, and I'm going to ask Rose Contreras with our office to bring up the official proclamation before I start melting before your eyes. For me, as a new supervisor here in the County of Orange, only the third Latino and the first person from Santa Ana to serve on the board in over 73 years, it is really an honor to proclaim August 6th through 12th, 2023, as Orange County National Health Center Week. And I encourage all of you, as we're going to do, to go visit a health center in your community and just thank them and let people know how important they are to our delivery of care, our making sure that our folks are healthy. But Isabel, let me turn this over to you, because I know you represent so many others behind you and shoulder to shoulder that work with you to make sure that our community remains healthy. And on behalf of the Board of Supervisors, and especially my office in District 2, this is with a lot of love. Keep the work going. Enjoy this week, but let's continue to uplift all our community health centers. Thank you.
Thank you. Is that picture? Oh, we gotta go to the front.
Oh, let's do it.